How's everybody doing? Right? Sue just talked about some of the things that I'm going to actually ask you to engage in a conversation with me after I sort of give you an overview of the culture of health about how you envision nurses contributing to a culture of health. So Sue just articulated some of the things, but the reason that you're in this room and those of you who are joining us online is because you're leaders. And so I want to tap that creativity and hear from you about how you're thinking about a culture of health, the Institute of Medicine recommendations, and what you see in your communities and in your organizations about how we can do a better job of connecting people to a culture of health. So, we just talked about a moment of why a culture of health. Building a culture of health, as you know, is our new vision, and I'm going to talk about how we take that vision to action. I'm always curious about where words originate from. The word culture is particularly interesting. It derives from Latin, and it means to cultivate. And that's something for us that we can't lose sight of, because culture is actually an everyday aspect of our life. It is part of everything we do. It's part of how we think, how we feel, what we care about, how we learn and teach, how we relate to one another. And I want you to really think about how we build that culture of health into everything that is at the core of being an American society. What does that mean? What if reclaiming, claiming, and sustaining health was a priority for everyone? That's not an easy task. What if it didn't matter how much you earned, how much school you had, where you lived, or where you were from to have health? That's what we mean by a culture of health. And we're striving to build a culture of health in this nation where everyone in our very diverse society can live longer, healthier lives now and for generations to come. And I want to spend a little bit of time talking with you all today about what really that means. How many of you understand right now what a culture of health means? Oh, you are a brave soul. I spend a lot of time talking to people across the country, and oftentimes people will say to me, I don't get it. I don't know what it means. It's so broad. It means so many different things. I would say to you that that is intentional. That part of what we want to do is help people to see that they have a role to play, and that a culture of health means different things to different communities and means different things to different sectors in our society. It might mean running a marathon once a year. For others, it might be having my kids be able to ride on safe streets or in parks. For all of us in this room, as healthcare providers, it means that everyone is being asked when they are in a clinic and seeing their provider, what is it like outside of the clinic for them? What other things in their life are impacting their health? Now, as I mentioned a moment ago, we all have a different understanding of what health means, but we all also know that one thing is for sure, that being as healthy as we can be helps us lead more productive and prosperous lives. And I don't care if you're a healthcare provider, a teacher, a business leader, that should resonate with you, and we should all value health because it impacts all of us. Good health helps everybody in our workforce to thrive. It helps businesses be more competitive today and tomorrow. And it keeps our military prepared to respond to any threats and to protect our interests at home and abroad. Caring about health is the reason that people build green spaces and public transportation now into cities and neighborhoods. Caring about health means reducing violence and making sure that our kids can enter school strong and ready to learn. These are the things when Sue talks about the work that you're doing in healthcare systems as public health nurses, as the coalition and the steering committee, to really think about the role you can play to help elevate health for the people who are your employees, but also the people in your own families and the people in your communities. It means addressing the interdependence of the social, physical, economic, educational, and environmental pieces of health. Those are core to health and well-being. And so how do you think we as a nation can start improving health differently? What does that mean for you? How do we get to a culture of health? Well, I think one thing, and Sue talked about this a moment ago, is we can stop defining health in this country as simply not being sick. What if we started working together so that we stretch our current understanding of health to get others to see how all things are connected to health? What would it look like if everyone in America recognized that health is a core part to every aspect of our life? So I'm going to share with you a moment of recognition that I had, because as Sue said, I didn't really get when I was in nursing school that health was about so much more than whether or not people got good care when they were sick. But when I moved from my small, relatively rural town in Massachusetts to Philadelphia to pursue my nursing education, I started doing clinical work, as all of us nurses do when we're in our education programs. And I noticed that many of my patients kept coming through the ER frequently. Didn't matter how quickly I just saw them or the excellent teaching that they received about how to care for themselves at home. They kept coming back through the ER. And it was coming back with conditions that should have been preventable and conditions that should have been controlled, like high blood pressure or diabetes or acts of violence. But they weren't being controlled. And for me, that really signaled that something was missing, that there was some disconnect between the care that we were providing and the care that they actually needed. As a provider, I was assessing their physical conditions, I was assessing their mental conditions, and I was treating the symptoms. I was failing to understand the cause. And over time, I learned that these patients were dealing with things that I had never experienced and that I didn't understand actually impacted health. Unsafe neighborhoods, joblessness, bad housing, or homelessness, no insurance, poverty. They were trying to survive in an environment that made being healthier extremely challenging. That was my aha moment. That's when I recognized that access to care is incredibly important, but it only plays a small part in actually being able to live a healthier life. So to make a change, I'm not sure where to point. To make a change, we need to start building a movement from the ground up. And you're part of that movement. You've already started to do that through all of the state coalitions. But in that movement, we need to change what we value and how we think about health, promoting, sustaining, and safeguarding it everywhere for everyone. And I want to underscore that. I truly mean, and the Robert Wood Johnson Foundation means everyone across the country. We need the partnership, the passion, and the promise of colleagues like each of you, because we need to be able to take this vision that I've just spent time talking about and create action. To do that, we've worked with RAND over the last about 18 months to develop an action framework, and it's intended to chart progress for the nation, but I think more importantly, it's intended to catalyze action across sectors, so that we can continue to make progress towards a culture of health. And one might say, well, what's the difference between a framework and a model? Well, I just want to point out that we were very intentional about calling this a framework, because a model implies that something is fixed, formulaic, and final. That's not what we envision here for building a culture of health. A framework, rather, speaks to built-in fluidity, an opportunity to utilize the structure, to personalize it, to run with it, and for any sector to own it and make it their own. This action framework combines components essential to improving health and motivating cultural change. The 4 action areas that you can see here are actually connected to and influenced by each other. That's why they overlap. And these action areas are intended to focus efforts and mobilize an integrated course of action by many individuals, communities, and leaders from across sectors so that we can achieve an outcome of improved population health, well-being, and equity. And I know that the folks in Kansas just recently had a summit on that included how do you actually advance nursing, but also the equity issues. And I do want to underscore and stress that equity and opportunity are overarching themes that are integrated throughout the action framework in each of these action areas. And while I may not explicitly call them out as I go through each of them, I do want you to take that away, that equity and opportunity are central and they are critical to the success of building a culture of health. So let me dig into each of these action areas. Maybe not. Action area 1 places our nation's values and expectations about health front and center. When people come together and collectively place a high value on health, it becomes a vital aspect of missions, it drives priorities, and ultimately influences how and where people live, work, and raise their families so that health becomes more accessible to everyone. Now you know this. In fact, it's part of the reason that the campaign is actually working to get nurses on boards, to bring that frontline perspective so that you can actually influence and shift how people perceive health and the role of nursing. Now, each action area includes a set of corresponding drivers, which is the orange box on this slide. It'll be a different color on other ones. And the drivers are really where the rubber hits the road. They provide a set of long-term priorities that we hope individuals and organizations across sectors will focus on, both nationally at the state level and within communities. Together, the action areas and the drivers create that key building blocks of the action framework, and they will remain constant over time. Below the drivers, you see specific measures, which I know are a little bit hard to read, and I'm not going to talk about them in detail because they're still evolving, although they're almost completely gelled. And the measures are evidence-based and uniquely focused on upstream social, economic, and policy factors that influence health and well-being. They are meant to provide a menu of actions that we as a nation can take to help build a culture of health and track our progress. Now remember, at the beginning of when I started talking, I asked you to think about the role that nursing can play in a culture of health. So as I'm going through this and you see the measures, think about the role that nursing can play in each of them, because I would really love to be able to take that out of our conversation today and to help stretch my thinking and yours about the role nurses can play. The last thing I'll say about the measures on this slide is that they aren't traditional health indicators. There are a lot of other data sets out there that track traditional health measures, and we really wanted these to encourage different sectors to think about health in broader ways, incorporating all aspects of well-being. Now, action area 2 is about fostering cross-sector collaboration to improve well-being. It places a focus on collaborations that include sectors typically viewed as outside of healthcare. Now, in recent years, we've made a lot of progress about cross-sector collaboration and working with different kinds of folks. But this is about ensuring that we continue to create more partnerships and that we help those partnerships reach full potential. The drivers and measures here are intended to energize existing partnerships and bring new allies together. We know that you're already doing this through the campaign. As you keep this good work up, keep welcoming new allies from those sectors that are typically viewed as outside of healthcare. Sectors like education, business, housing, transportation, because those are the sectors that impact health. And quite frankly, the healthcare sector alone cannot and should not bear sole responsibility for improving the country's health. And these historically non-traditional sectors have an essential role to play. Action Area 3 is about creating healthier, more equitable communities. In America today, too many people's health is tied to how much they make, how much school they've had, the neighborhoods they live in. People's health has a lot to do with individual decision making. There is no disputing that. But the choices that we all make are based on the choices that we have. So let's be clear about that. The choices that we can make are based on the choices that we have. And the goal of this action area is to encourage communities to fulfill their greatest health potential by improving the environment in which residents live, learn, work, and play. It's about expanding the choices that people have and their opportunities to be healthy. Measures here that we're looking at include early childhood education, youth safety, complete streets policies that together take into account the physical, social, and emotional and economic factors that can make the healthy choice the easy choice for all. And I want to just take a moment to illustrate the point about where we live makes a difference to our health. This is the DC Metro map, and it's the subway line, and in the circles is actually life expectancy. So people who are born just a few miles or a few subway stops, metro stops, apart from each other have a life expectancy difference of up to 7 years. We have to change this. Everyone in America deserves a fair and equal chance to pursue health and to be as healthy as they can be. The last action area focuses on strengthening integration of health, services, and systems. This action area is really at the heart of a lot of the work that you're doing, and it's about strengthening the system of coordinated care that integrates and better balances medical treatment, public health, and social services. By driving access, consumer experience, and quality, and balance and integration, we can build a culture of health that empowers people. You really are in the trenches on this one, and from your efforts to reduce barriers to care, in particular to increase access to care and scope of practice, and to bring the voice of your patients forward to ensure that their needs are met. This is something that we need to continue to do. Now, this brings me to the outcome. The action framework ends here with improved population health and well-being and equity. Because as we think that, as we've thought about this, we think that action in the 4 action areas, as I talked about, will actually help us improve outcomes in population health, well-being, and equity. Because we recognize that building a culture of health is a shift. And in order to have this shift happen, we know that we need to be clear and give people points of entry, that they may not necessarily see themselves as part of the solution, but by having the action areas and being clear about the drivers and measures, we hope that that engages people so that they can see themselves as contributing to building a culture of health. Now, we also know that trying to make this incredible cultural shift for our nation, it's going to probably span a generation or more, and that we need a movement for health to get us there and to help us achieve it. So, how can we do that? How do we make this vision a reality to bring this action framework to life? To do more than think big, we need to act together. The fact is that cultural shift is going to take hundreds, maybe thousands of moments of recognition like the one I told you about when I started nursing school. If we are to make that happen, we have to realize that we are all in this together. And I know that when I talk to people, and you may be thinking this, like changing a culture based on a single idea is never going to happen. But in fact, it has happened. It's happened many times before, but the one example that I'm going to choose to share with you today, I chose because it's different than a field I work in. I've worked in tobacco, and I could have told you about how we got to smoke-free air. I could have told you about the 911 system and how we didn't have that, and how the reason and the impetus behind that. It was all sparked from one idea. But the one that I chose to share with you is actually this. In 1962, a scientist and writer by the name of Rachel Carson published a chilling book called Silent Spring, warning of the effects of chemical pollution on the world around us. Back then, we filled our car tanks with leaded gasoline. We accepted that chemicals in our air and water were just a byproduct of industrial advancement, and no one had heard the word environmentalist, let alone the word recycling. A book started that movement. It sold 500,000 copies, and a few years later, we had Earth Day, and 21 million Americans rallied in parks, neighborhoods, and streets nationwide. People started asking what they could do to make change happen, and they realized that they each had a role to play. If they could collect and repurpose all the bottles and cans and give the paper and cardboard another life, they'd be doing something to make the world a cleaner, healthier place. Today, most of us do it without thinking. Our cities, schools, and towns make it easy for us, placing recycling containers where we live, where we work and play. It's so ingrained that most of us feel guilty when we don't do it. That was unheard of 40 years ago. Catalyzing simple behavior changes and building in the systems, sometimes complex systems, to support those behavioral changes makes a difference. From all of us seeing a role for ourselves, individuals, families, communities, and businesses, nurses, physicians, faith leaders, and policymakers, that's where change comes from. And that's what we'll build as we build a movement for a culture of health. The seeds of this idea are already growing. I know because I've seen them planted by partners like you, but not just in nursing. I've seen them planted by scholars, researchers, so that we know what works. I've seen them in the innovative practices that you all have developed, but also that are being developed in the business community, that are being developed by health leaders, but also being developed by education leaders who are starting to see the connection between health and education success and long-term sustainability of our workforce and global competitiveness. People are seeing these pieces fit together. And I wanted to just share one example of how this is working at the local level. So one of our Culture of Health Prize communities, which I know Julie Willems Van Dyke is here, there she is, and Julie will talk a little bit more about the Culture of Health Prize, but I wanted to share Durham County, North Carolina's story. How many of you have ever been to Durham, right? So it is in the heart of tobacco industry, right? They have a lot of challenges there to their health. For decades, the county has struggled to overcome both racial and socioeconomic inequities. The community continues to face high rates of chronic diseases, poverty, unemployment, and low high school graduation rates. So they're challenged. But most of us think of Durham as a place that has incredible healthcare resources and a place that we might want to go to receive care. Well, in Durham today, over 500 community leaders from their healthcare partners, their residents, and other community leaders are coming together as one. They are actually forging a new approach which they call the Durham way. And it's really about setting a common goal for them to address the county's challenges and to build a culture of health. And for them, the fruits of their labor as they've moved on this path, and they're nowhere near the end. In fact, I would argue that no community in the nation is anywhere close to achieving a culture of health. There is always room for improvement, and this will always be an evolution. But what it looks like for them in terms of their success and where they are now, because they're pretty far along, is it looks like 32 miles of new bike paths, new education and career development preparation efforts, smoke-free policies in virtually every public space, including outdoor smoking. It's pretty amazing for Durham and for any community actually across the country. The successes also look like nurses, physicians, and hospitals donating specialty medical care to the uninsured, ensuring that the community benefits from Durham's world-class health resources. Durham is succeeding because people are working together towards a common goal. Oh my goodness. Working together towards a common goal. The efforts that they're taking on, I think, illustrate how a community can come together and, one, put its competitive differences aside, but work for the betterment of the people by engaging the people and not letting institutional silos, institutional competitiveness, or a lack of understanding get in the way. They really are being boundary-spanning leaders and pulling together around that common goal so they have a clear path forward. So my message for you, and I think Sue talked about this a moment ago, is that we need you. We need your ingenuity. We need your creativity, your innovation, and your inspiration to make a culture of health happen. You have deep connections to your communities, and we need access to that. Your expertise in what works in your workplaces and your neighborhoods, your guidance on how to spread the word through your personal and your professional networks. It may take us a generation to achieve, but we're committed to seeing it through. And I really hope that after today's discussion, and as we continue to the discussion, you become committed to building a culture of health in new ways. The truth is that even though Robert Wood Johnson Foundation is the largest national foundation dedicated to health, we don't make policy, we don't sell anything, and we don't have the power to build a culture of health without you and without the action of many. The only power we have is the power to partner. We do this by collaborating with you, investing in, supporting, and spreading your ideas, your innovations, your dedication, and your collective will. That's what we can do at the Robert Wood Johnson Foundation. And we know that we must work together to turn small victories into this national success. When you look around, you'll see that the idea of a culture of health already exists. You can see it at local farmers markets. How many of you have a local farmers market where you live? I'm curious, how many of you have local farmer markets at your workplace? Yeah, more and more that's happening. You see it in your neighbors when they take a walk after dinner. How many of you do that? Right? I submit to you that you can because your neighborhood's safe or you have a park that's easily accessible. Right? So think about that and how you can work with your community to sort of help elevate that and get people engaged. You can see it in the way that business leaders are focusing on early learning and childhood development, something that most people don't think of as connected to business, but business leaders are seeing it as key to growing their workforce and key to their building economic prosperity and our global competitiveness. You see it in the shift in how nurses are valued, how they're valued for their leadership, their critical thinking, and their deep connections to community. They are a trusted voice. You are a trusted voice, and we need to tap into that. Now, I just want to end with a few words about the campaign for action. As Sue said, it's been an incredible journey, and that journey is not over. This is not a stopping of course. This is a evolution, if you will. And I want to thank both the AARP and the AARP Foundation, Sue and Susan and Lynn, because without their leadership, we would not be where we are on this issue. It has been a really powerful piece, and as a nurse, I can tell you that I'm not sure I ever expected to see in my lifetime such a power come through the nursing workforce. But lately I've seen a lot of things with the Supreme Court decisions that I didn't expect to see in my lifetime, and I gotta tell you, way to go. So with the Campaign for Action, you have the power of people. You've built an incredibly large network, right? It's not just nurses, it's not just physicians, it's insurers, it's business leaders, it's community members. And so being able to leverage that network, both to accomplish the recommendations of the Institute of Medicine report, which is very important, but also to think about making those connections and helping people to get excited about building a culture of health. Because if we don't have that cultural shift, we will not be successful as a nation. That people power that you have, it's unique. It is an essential role to building a movement for the health that we many times are so privileged to have and so unaware of how many things go into that. But I really do think that with leveraging those people, we can actually ensure that people across the country, again, no matter where they live, no matter how much they make, and no matter how much education they have, they can have exactly the same opportunities to health that we all have. The seeds of a culture of health have been planted. They are starting to grow, and we need to help them grow so that health reaches everyone. And that is what's going to help us rise to the great nation that we can be. We have a long way to go, but the potential is there. We have a powerful, powerful community right here in this room, and you have a powerful, powerful community back in your home states. So I look forward to hearing your ideas on how you can help contribute to a culture of health and how we at the Robert Wood Johnson Foundation can help you to do that. So thank you for your time this morning.